We still have this policy of mass vaccination, and I do want to query this on behalf of constituents who have written to me. And my query starts with this simple point. In October 2020, when the vaccine was getting ready for rollout, Kate Bingham, the head of the Vaccines Agency, said this: there's going to be no vaccination of people under 18. It's an adult-only vaccine for people over 50, focusing on health workers and care home workers and the vulnerable. Now, why was it extended to the whole population? I don't think we've ever had a completely satisfactory answer to that question. And I raise it because my concern is that in extending the vaccination programme, it became an operation in public persuasion, an operation in which dissent is unhelpful or even immoral, justifying suppression, even vilification of those who raised concerns. Happy to give way.
I thank my honourable friend for giving way. Would he also question, unlike any other vaccine, the vaccine was actually given to people who'd got natural immunity because they'd actually contracted, and provably contracted the virus, and so they would have had natural immunity. Why were those people vaccinated?
My honourable friend is absolutely right. The best vaccine against COVID is COVID, and many people were indeed naturally immune, and I think there are questions to be asked about the effects of vaccination on the immune system. Now, I do understand why, and my honourable friend, Member for Cotswold and Wallingford, made a very understandable point about the importance of resisting misinformation, and certainly there, as I mentioned, many crazy theories out there which we need to not give credence to. If we're talking about a programme of vaccinating the population, it is important that the public is persuaded to do what the government wants it to do, and I understand why the government should have a public health information campaign along those lines. But it is an essential principle of medical ethics that people need to be able to give their informed consent before any treatment. And I do worry about how we can say that consent was fully informed in all cases. Throughout there has been, I wouldn't say deliberate, but there has been some misinformation, possibly accidental, in favour of the vaccine. We can tell this with hindsight. Perhaps the most egregious, and the doctor that my honourable friend mentioned earlier presented on this to the APPG last week, Dr Malhotra, the claim that the vaccine is 95% effective. But what that means is simply the relative risk, not the actual absolute risk, reduction in risk to an individual. The absolute risk reduction is really less than 1%. There was the widespread claim that the vaccine stops transmission, so people should take the jab to protect other people. We were all told that. We all believed that for many months. Last month we heard from Pfizer that their vaccine was never tested to see whether it would stop transmission. And yet we had the notorious claim by Professor Chris Whitty that even though the vaccine brought no benefit to children, children should be vaccinated to protect wider society. Now, I'm all for thinking about society, not the individual, Sir Roger, but that, again, it feels to me a profound break with medical ethics. And a lot of people are asking what the vaccine does to children and young people. And Dr. Whitty is right that the benefit to healthy children seems to be essentially nil. And yet there are genuine questions to be asked, and I do not verify these questions, I merely ask them on behalf of my constituents. How do we explain the increase in the rates of myocarditis, the increase in heart attacks and the excess deaths among young people? And indeed in the general population, it is plausible, not definitive, but plausible, that the vaccine is responsible for more harms than we know about. And I mentioned in my intervention earlier that we know from the yellow card scheme that up to 1 in 200 people vaccinated report an adverse reaction. And that is in itself bad enough. But we also know that yellow card reports, the adverse effects are significantly underreported through the yellow card scheme. Based on the MHRA's own research, there may be as many as 10 times more serious adverse reactions, serious ones, not just any ones. There may be 10 times more serious adverse reactions than the yellow card system shows. Now, I mentioned these rather terrifying facts, and there may be innocent explanations for them, and I very much hope they are. If these are conspiracy theories, we need them to be comprehensively and courteously debunked. So I have 4 questions for the Minister to close, Sir Roger. First, will she review the vaccination of children? We know that children have strong naturally acquired immunity and that the chance of death from COVID for a healthy child is 1 in 2 million. So I believe that we should follow other countries like Denmark and stop vaccinating children altogether, but I invite the Minister to consider reviewing that aspect of the policy. Second, will she make representations in government and with Baroness Hallett that the terms of reference for her inquiry should be broadened to explicitly include the efficacy and safety of the vaccines? And I hear what my honourable friend says. He's absolutely right, that the inquiry does include reference to the vaccination programme and its effects. And he may well be right that that is sufficient and that the review will properly consider the topics that we're discussing today. I hope that that is the case. But I think that needs to be made more explicit, and so I'd invite the Minister to comment. Happy to give way.